Hello and welcome to Spectator TV. I'm Kate Andrews, the Spectator's economics editor, and I'm joined by Karol Sikora today, an oncologist, a founding dean at the University of Buckingham's Medical School, and a contributor at The Spectator. Karol, thanks so much for joining me. We wanted to invite you in today because you wrote a very interesting article for the Daily Telegraph last week where you decided to endorse and indeed say you were going to vote for the Reform Party because of their position on the National Health Service. Tell us why.
I've looked at all the parties' proposals, and that's the only one that's really radically different. Labour's not bad, and it's not far off, but there's no doubt the Tories is way off the mark. It's just unrealistic, as are some of the others. What I liked about Reform, there was something completely unique, trying to incentivise young people to get into healthcare. It doesn't matter what, not necessarily to go to the top of healthcare, but to come in at the bottom and work through it by tax breaks. And I thought, what an interesting idea. And maybe that would just do it and get people in at the bottom, and some of them would get to the top.
It's a real pivot away from what we've had for well over a decade now, where there's not only been a cap on the number of medical students, but really there's been an attempt to train fewer doctors. I think all political parties recognize the huge mistake that was. They're trying to rectify it, but you think Reform has the best way of doing it.
There's no doubt that it won't solve the backlog that we've got now. It won't solve it instantly. It'll take almost a decade to really bring it into balance. We just can't import 30 or 40,000 doctors every year. There just aren't these people in the world, especially when the working conditions in the NHS, both salaries and general conditions, are less favourable than other countries, Canada, Australia, New Zealand and so on, English-speaking countries with free migration. So it's not realistic to think we can import doctors. We've got to train more.
Well, that's an interesting point you make. Many politicians like to talk about the NHS as the envy of the world, whether or not the workers, especially foreign workers who might be looking at different healthcare systems, feel that way. It's a different point, but I want to come back to immigration and also comparisons between healthcare systems. I want to pick up on something you said. You said Labour wasn't far off Reform's agenda. I'm not sure the Labour Party would like to hear that or would necessarily agree with you on that. Why do you think that?
I think it's an interesting concept. We're streeting, making the right noises.
Yes.
Right noises about the only way to clear the backlog is to pay overtime. That really is the truth. We've got to fill hospital car parks at weekends, and they're empty still. With diagnostic equipment, treatment equipment, certainly in my specialty, cancer, expensive machines costing £5 million just lying idle for 2 days. This is ridiculous. Sure, we've got to love the staff more. My daughter works in hotel management and they love their staff. If they're working late at an event, they get them a taxi home. Food, it's free. You just help yourself, a cup of coffee, free. NHS doesn't do that. You don't feel loved in it. And I think that's the key. It's not just about money, it's about role in society and working for an organisation that you like. And I'm afraid the NHS in many places isn't that.
We don't talk about this enough. The fact that when we're discussing reform for the National Health Service, we're not just talking about what patients experience and their outcomes when they come out the other side of the NHS. We're also talking about the staff, the doctors, the nurses, the medical staff, the cleaners, everybody involved in the National Health Service. It's one of the biggest employers on the planet. And as you say, it's quite grim in terms of pay, in terms of hours worked, in terms of lack of staff, so the gaps that you have to fill in. In so many aspects, it's thankless. It's an incredibly hard job. There are elements of that difficulty you're never going to take out when you're dealing with life and death and emergency situations, but you can compensate properly, as we see, through other universal-style healthcare systems across the world that aren't the NHS.
No, it doesn't love its staff enough. And also, if you look at it, it's very pyramidal. There's a huge pyramid, the top and the bottom, many healthcare assistants, and there's no opportunity to move up and down in that. Now, my vision for the future would be everyone can join as a healthcare assistant. You don't need any qualifications at all. You just have to have an ability to care for people and the right attitude to dealing with people. You have those people at the bottom, but they can move up. They can even go to medical school, some of them, if they're willing to work, if they're bright, if they can get A-levels at night school and so on. This has happened in the past, but it's very difficult now. People are boxed in, and it's all part of this loving the staff, letting them go on courses, ensuring they go on courses to increase their career potential. Industry does that. Even other public sector bodies do that. The NHS tends to ignore it. So we haven't got any money to send you on a course. And this is the wrong attitude. We've got to, in the long term, but the short term, I'm afraid, is about persuading people to work overtime to clear the disaster we've got now.
You've been in oncology for over 50 years, haven't you?
I have.
How have things changed in that time? How has the NHS changed?
The NHS has changed in many ways for the better. It's got better organisation around cancer. The big problem in cancer today is nothing to do with its treatment, the radiotherapy, chemotherapy and the surgery. It's to do with the diagnostic phase. So first of all, it's difficult to get an appointment with your GP. Then it's difficult to get a hospital appointment. The 2-week wait was abandoned last year. So there's no metric of how long it takes to get actually the diagnosis made. In that time, if you have cancer, it's growing in the organ it arose, breast, lung, colon, wherever, and it's spreading. And that is why our mortality statistics for cancer, normally the 5-year survival percentage, is lower than the rest of Europe. It's down the very bottom of 30 countries, it's about 27th, 28th. And it's because the diagnostic phase. Once you get to the front of the queue, you'll do fine. You get world-class therapy, and that's the problem, and that's changed. It's really so slow now, and you know, I liken it to the NHS can do things. It can do marvellous things. The COVID vaccine program was just amazing, and suddenly I've still got the batch numbers on my mobile phone of all the vaccines I have. That's about all I can get from the NHS, my batch numbers. I can't use my phone to do anything else. If we can do it for COVID vaccination, we can surely clear the cancer backlog, and that's what needs to happen with the overtime.
You sound very pragmatic on the NHS, and I'm curious as to how that led to an endorsement for reform, because as you say, if we look at what the Tories are promising for the NHS, it's more money, it's a magical number of more doctors appearing out of thin air. It's the kind of stuff we've heard before, and it simply hasn't worked because they're just piling more money on top of a fire, frankly, and it's going up in flames. Labour talks a good talk on the NHS, and they seem serious about reform when you speak to them. I have to say, the manifesto didn't include a lot of those elements of reform. I thought the manifesto was very watered down, but we have heard what they're saying. We get an indication of what they might like to do. Where Labour and Reform are very different is what they've actually written down. Reform says it wants a royal commission to look at other healthcare systems. Nigel Farage keeps talking about France. But if anybody is in a position to reform the NHS, that's going to be the Labour Party. I'm not even talking about, well, I am certainly including the polls in that, but if we had to weigh this up between whether or not it was more likely to be the Conservatives or Reform, it would probably be more likely to be the Conservatives to be in a position to do something with the number of MPs that they're going to get. So why have you endorsed Reform?
I think because even though Labour are making the right noises and they're talking about removing the holiness, the shrine value of the NHS, they'll be held back. They'll be held back from actually doing that by the bulk of their voters. And the bulk of the philosophy of the Labour Party. Reform has no track record of any philosophy. They can look at it pragmatically, as I would look at it. Let's just solve the problem, the immediate problem, the overtime, the long-term problem, training, and how we fund it. And we've got to dampen demand somehow. I mean, the demand on the NHS is huge, and it's my generation that's causing it. My generation consumed vast amounts more than your generation from the system. And of course, there are more and more people over 60 coming along now. And over 60-year-olds consume 5 times that of a 30-year-old. We know that in any healthcare system. We've got to be pragmatic and say, if that's the problem, let's work out a better way to distribute the system so that we can have the care for everybody in it. It needn't be more money, it's better organisation, and we need to get that.
Are you convinced Reform is the only party willing to talk about that? Do you think Labour perhaps would if it ends up with its supermajority, as the polls are suggesting?
I think it's interesting. Reform, the idea of the tax breaks gets you at the bottom. It gets people in, because a tax break on the baseline tax, the low level tax, means that the more senior people don't get much joy out of it because they're paying in the higher tax bracket. So it's a clever way of doing that. Whether it will actually change the whole system, I don't know, but at least it would encourage people to go into healthcare, and that's what we need to do. The nursing schools are empty; they can't recruit nurses for training. All sorts of. My wife's a nurse. Nothing wrong with nurses, and it's totally changed nurse education, not for the better, and it's not attractive. And so, why is it not attractive? We've got to work out why people don't want to go to train as a nurse. The same for things like radiography, physiotherapy. We can't keep recruiting people from overseas. We've run out of people to recruit. It's also unfair ethically to recruit from poorer countries just to come here. Different if it's for training. So I think the future's got to be about balancing the staffing issues and then finding mechanisms to retain staff by being pleasant to them.
Why do you think it is unethical? Why have more responsibility to a country as a whole, a collective, than an individual who wants to change their life and come here and make it better?
I think most of the staff from overseas are recruited by agencies that go there, put adverts in the local papers and get 100, 200 people to come to the UK. The Philippines is one great source for nurses because there's an excess of training schools there for the needs of the country, and that's sort of fair enough if there's an excess. But in many countries there's not an excess, and you're essentially stealing the product of their educational system to come here. Now, if it's for
Australia is stealing the product of the UK's educational system.
They're pinching out. I mean,
but we wouldn't say to the individual doctor or nurse that they're really making the wrong decision. They're going where's best for them. We believe in individual agency.
Absolutely. The world is one marketplace for staff, and that's why we've got to be nice to our staff in the NHS. It's a matter of a balance, not just salary, the whole thing. They've also got to feel they can achieve something in our system, and I think quite a lot of younger professionals, not just doctors, but the whole set of healthcare professionals that we have, don't feel they're going to get anywhere in our system, and we've got to change that.
So this was one thing that I found odd about the reform contract with the people. It's not called a manifesto. I didn't find it odd in the sense I wasn't surprised to hear Nigel Farage talking about cracking down on migration numbers. But as you say, this is a long-term work strategy. This is not going to fix things overnight. And very often when we get to an election, I'm not sure it'll happen this time, very often in the past, you get to the last week of an election or so and you see these ads from Labour saying 24 hours to save the NHS, 1 week to save the NHS. And the idea is that the Tories are somehow going to destroy the NHS. In truth, they've been putting more money in real terms every year over the past 14 years, but that's another point. If you really wanted to destroy the NHS overnight, you might have something like reforms immigration policy. They're one in, one out policy. I mean, best of luck to your social care, best of luck to your NHS staffing. Because again, this isn't about over the next 20 years, it's about what they would do on day one. That is the policy that overnight might destroy the NHS.
I would assume they would have exemptions for healthcare staff, and you couldn't possibly get the NHS to where we want it to go if you had that policy.
Well, it's interesting. Nigel Farage, I think there has been talk within reform that they've acknowledged that health and social care is where they would have to make exemptions. Of course, you've got the Tories on the other side who are cracking down on the family members that health and social care workers can bring. It feels like no one wants to have the really honest conversation about this right now, that the NHS cannot really operate at the moment without immigration.
Absolutely, it's not possible. And care homes can't operate without immigration. I mean, if you go around any care home, any hospital, the majority of staff, highly competent, are not from the UK. And we've come to accept that because we've been so slow at training our own. And also because it's so deeply unpopular with young people. I mean, the reasons for that are not clear. Even medicine, I mean, it's bizarre. You have to have 4 A-stars, and you have to be able to communicate well to get into medical school. It's almost ridiculously high hurdle. But to get in at the bottom, it's much easier. What we've got to do is have a transition within the system for people that have ability to allow them to come at the bottom and go to the top. Medical schools have a lot of widening participation initiatives. People from poorer backgrounds, from deprived postcodes and so on, trying to encourage them to do medicine. The other way to do it is let everybody come into the healthcare system and select from within people that have the ability and also the determination to go through a training program.
So Nigel Farage has mentioned France's healthcare system quite a few times. Do you think that's the one the UK should eventually be trying to pivot to, or do you have a specific idea in mind about what reform might look like, and also what's practical or realistic for Britain?
Well, I guess the French system is interesting because you pay a little bit of money to do anything in it. It's not free at the point of care. The NHS is a completely free system, so people pitch up in the emergency room at 2 in the morning with a cut finger and expect to be treated. You wouldn't do that in France. There are disincentives for you to consume healthcare. Small disincentive, €100, something like that, but you can get seen the next day or the day after. You can get a CT scan if you have a potential for having cancer. It would be done the same week. Here, it could take 3 months before you get the key diagnostic scan for cancer. So it's a different system. How we can introduce that here, it's very difficult. I remember Sunak 3 years ago toyed with the idea of a £10 fee to see your GP. That quickly was shelved because voters, if you've had something for free for all your life, you're not going to want to pay for it. But doing something to make it more like the French system, to make people more responsible for their own destiny, would seem good. The problem in all countries with healthcare is that the top 5%, top 10% don't care, because they can opt out of it. If they're told it's a 3-month wait for a CT scan, they go and get one in the private sector. Yeah. And there are Go Compare sites on Google in London, for example, where you can get the cheapest CT scan tomorrow. So they can opt out. And that's the problem with healthcare, which is unlike anything else that we as a consumer good.
Carol, a lot of people get nervous when people talk about NHS reform because they immediately think about the United States, because they've been coached by politicians, no less, to believe that the only two systems in the world are the NHS and the USA. We had Michael Cannon from the Cato Institute on not too long ago. He is a free market economist in healthcare, and the free market economist was saying, you know, I wouldn't wish the US system upon you. Nobody thinks that's a good idea to bring to the UK or anywhere else. The US has a lot to learn from the rest of the world, as does the UK. So tell us a bit more about what Nigel Farage means when he talks about the French system, and also, do we think that is plausible? Because in Britain there's a real sense that nobody wants to pay when they show up to receive medical care at all. They are worried about the inequalities that might surface.
I think Streeting would make a chance of it,
make
a go of it, but he'd be held back. Reform could actually just do it, and that's why I'm fairly supportive of something like that. The real paradox is that what I mentioned earlier, as we get older, we consume more healthcare. So if you try and get a private insurance policy at your age, you'd probably get it for $2,000 a year. For me, it would be $10,000 a year, so it's not worth doing. I mean, I don't have private insurance, and probably you don't, unless Spectator's very generous. So I think and that just reflects that older people cost more in healthcare and utilise more healthcare, and it's in every country. Now, in a tax-based system, and only tax-based, completely free at point of delivery, it fails because the older people are consuming the tax of the younger people that are working, because they're not working. Sure, they're paying tax on the pension, but it's a lot lower than when they were working. So it's a sort of balance that's out of kilter with their demand. So how can you put that back? I guess you have to allow for it in the healthcare system financially. And you can do it by death taxes, dreadfully unpopular inheritance taxes, estate taxes, or you can do it in some other way. You pay more tax up front until you retire, and then you pay less, but you've paid your subs. The other big problem, other than the aging population, is technology's moved on. You can do heart transplants in 80-year-olds. You know, I mean, that's an extreme, but you can do them, which you couldn't 20 years ago. Cancer treatment, there's no age limit, there's no barrier. When I was a young doctor, you couldn't get kidney dialysis if you're in kidney failure if you were over 55.
Oh, wow.
And that's changed. Liver transplant stopped at 50.
Wow.
And now there's no age barrier, it's a sliding scale. We have people on expensive cancer drugs over the age of 90. And you think, is this the right way to go forward? Who knows? Society has to decide.
It's a very grim decision, and one that ideally a reform system would lessen the blow of. I mean, every developed country in the world is dealing with this issue of changing demographics and an aging population. It isn't just the UK. Every health system is under strain because of this. But NHS-style systems, single-payer, pay-as-you-go systems, where, of course, if you are in your 80s, 90s, you have paid into the system over the course of your life. But it didn't go into a pot with your name on it that you're taking out of now. You know, that is money that, you know, whatever you're using is coming out of the tax funds from that year. That is a system that is eventually going to break. And we're already seeing it break. I mean, this is perhaps what's most frustrating to me, and I don't know if you feel the same way. When you have over 7 million people on the NHS England's waiting list, and there's a very obvious reason for that, the fact that they were told to stay home for several years during the pandemic. But the fact that they had to be told to stay home, that the NHS couldn't cope with cancer treatment alongside COVID, the fact that 7 million people are waiting potentially for something quite serious. Is that not a broken system already?
It's crazy. And of course, those that have the resources are opting out to get it done privately, which is sort of, they've paid their taxes, they've got a sort of a contract, an ethical contract with the government that you will look after me. I've paid my taxes, I've paid millions collectively into the NHS budget, and now I can't access it. You know, I think there'd be a great opportunity for someone to sit down and act as a mentor to how to work the NHS. Beat the system. And I think if you knew how to do it, you could get fantastic care. I always say that. I'm giving a talk later this week to ultra high wealth individuals in London about how to get good cancer care. It's not obvious. Say you have unlimited resources.
I'll give our viewers the tips.
Yeah. So you have unlimited resources. What would you do if you had cancer? You know, you can get the best treatment in the world out of the NHS. That's what I always say. The difficulty is it varies. So sometimes you're in the postcode and your route through the system takes months, it's poor quality, you're not seen by the right person first, you go on a journey of series of mistakes and you can't do anything about it. You feel helpless in the system. We've got to change that, you know, and you don't need to use money to change it. You need to make the whole flow of patients much better and much more friendly to the end user, the customer. And that's why I think reform value patients as customers rather than as patients. Even the word patient is the same as Pascal, the suffering, pathos, suffering. So patients are sufferers. Now you wouldn't say, next sufferer please come into my clinic. You would never call them that. So, and we don't talk about cancer victims anymore. We talk about people living with cancer. And so I think the future is about putting what we call patients now in the driving seat within the system and helping them to manipulate the system. But we have to have the capacity, and there isn't the capacity at the bottom of it because of the staff and because of the equipment and the lack of organisation.
As you said in your Telegraph piece, you think it's very helpful that reform is coming forward and coming up with something truly radical and different. Is it helpful when their contract with the people has been written up and analysed by big economists and is ultimately thought to be wanting in terms of any kind of serious financial credibility? In a contract, I have to keep saying contract with the people, it's not a manifesto, in a contract with the people where you're promising £90 billion worth of tax cuts, £50 billion worth of spending cuts. I mean, this is, you know, what Liz Truss was trying to do, but, you know, recrafted and rethought out for reform. Is that really the kind of manifesto or contract with the people where you want to see these ideas? Aren't a lot of people going to look at it and go, well, that's pie in the sky? I
think, you know, when you look at all the policies, it's all the same. They're uncosted properly, and some of them are unrealistic. Now, ideas in reform that I like the sound of. There are ideas in Labour and the Conservative. They've all got good ideas in them. The trouble is they're all going to cost a lot of money. Now, the way to get them implemented is to have decent management at a local level. Task-oriented, not the way it's done at the moment. It's not task-oriented. You've got to have a chief executive for a hospital, but you've also got to have decent management by professionals in all the little contributory parts to a hospital.
Karol, my last question to you is about what else is in Reform's budget and how that might affect its plans for NHS reform. Because, you know, you say that you think these are the most innovative, radical ideas in any manifesto about how to reform the health service. But isn't that harmed by the fact that they're put alongside policies that for many people seem like economic fantasy? £90 billion worth of tax cuts, £50 billion worth of spending. You know, name that might come to mind is Liz Truss or a mini budget. People don't really think that these numbers add up. And if you have numbers that don't add up next to these kinds of healthcare policies, people are going to say, well, that doesn't add up either. This is pie in the sky thinking. It's just not going to happen.
I think the NHS is an enigma that's never going to be solved. I think that is the bottom line. No party is going to solve it quickly. The only way is car parks at weekends. That's my bottom line. Get them full somehow.
Karol, thank you for joining me.